from what we can garner from the literature, about 10% of people will have ongoing symptoms. Those ongoing symptoms may be the chronic fatigue that occurs. They may be the respiratory shortness of breath that needs time to recover, where physiotherapy or occupational therapy may not improve with the interventions. We have seen a number of people where they've come through prolonged intensive care unit stays, and they are deconditioned in many ways, physically as well as mentally.
Recovered patient Renato Ramirez shares how he felt while struggling with lingering symptoms.
You lose hope, you feel alone, you feel like you're drowning. I believe this is the effect. Once somebody around you and gives support, for sure it will change your mind settings. Like it will give you hopes, courage, and you're inspired for everyday challenge of life.
Our clinic is called the Step Up Clinic. It typically does see stroke patients who've perhaps been discharged from hospital, perhaps mild stroke in the community. And very similarly, we've taken on the role where we're trying to prioritize those people. Typically, when you come to our clinic, you require 2 out of 3 of our disciplines. So our disciplines are physiotherapy, occupational therapy, and speech and language pathology. This helps in particularly the areas of cognition. If people have more than one area of deficit, then these are addressed by our team.
The target group for this clinic are neurocognitive patients. Dr. Thompson shares another patient's experience when he tried to return to work.
He is having difficulty with word finding, having difficulty with multitasking in his role, and actually had to step down from his role temporarily as he resumed employment. So those are the types of people that we typically would like to address so that we get those folks back to their pre-illness status, and that get them well and functioning.
After many weeks of successful treatment, Ramirez is now back to work full-time.
Before, I don't remember anything. From the beginning, I'm totally zero. So step by step, they make my memory back.
Halton Healthcare's program is one of a few for COVID syndrome.
The setting up of this clinic really exemplifies the commitment of our staff, our rehabilitation staff at the front line, our group that support the Step Up Clinic, which is our physiotherapist, our occupational therapist, and speech language pathologists. They are super committed and are really stepping up to enlarge their skills and have done some extra training that will allow them to treat our patient population.
Special thanks to my therapists, Susan Girling, Julie Wilding, and Sarah Hori. I will never forget them. Please tell them from the bottom of my heart, I'm very, very thankful and grateful for their help.
Reporting for Halton News, I'm Nikki Wesley.